For such a challenging and traumatic and intense time to find out something is wrong with your baby, they were the best people to take care of us. This was at our 20-week anatomy scan. We went in not really anticipating there being any challenges or difficulties.
Yeah, and funny enough, we saw everything on the screen. You could see the heartbeat, everything looked fine. So yeah, we were kind of under the impression that, okay, we're good.
On the screening fetal ultrasound, we saw a pretty large left ventricular aneurysm, which is an outpouching and a little balloon. In addition to that, one of the heart valves was leaky. There was some mild arrhythmias, and there was some fluid around her heart. We
had twice-a-week scans for the rest of the pregnancy, so we got very familiar and very comfortable with the people both at cardiology and in MFM.
We'll look at the heart, we'll look at heart structures and blood flow function and rhythm, and we want to make sure there's no complications, such as heart failure, such as arrhythmia, or blood clot.
Dr. G really explained it as, this is such a rare condition.
Like on a handful, he's seen it only a handful of times.
It is probably in the neighborhood of half a dozen patients per million. So a few out of a million. We have a wonderful institutional relationship with the Children's Hospital of Philadelphia, and in particular, our heart program, we're very closely collaborating with them. So the babies with a heart problem before birth. And after birth, we will continue to work with them. If they need a special type of diagnostic or treatment strategy, such as heart surgery or heart transplant.
Dr. G was phenomenal with communicating with our CHOP physician, Dr. Rychek, the whole time. Every time we would see Dr. G, he would message Dr. Rychek, let him know what was going on, and vice versa. So we definitely felt that there was a good form of communication between the two. Once we hit the 36-week mark, though, we were required to move town to Philadelphia for the last 4 weeks to deliver there. My water broke at 1 a.m. and I had her by like 5:30. I held her for about 30 seconds and then they took her, and I didn't see her for 24 hours, so that was really hard. Mitch got to go over with her for a good chunk of time, but I did not get to give her her first feeding. I did not see her, so that was really tough for me.
She's doing so well now, and we're so thankful for it.
If you look at her, you wouldn't notice that she has a heart condition. Her heart is functioning very well. When we do the echocardiograms, her heart muscle contracting very well. She is on 2 medications. One medication to help her heart function to perform better. The other is a blood thinner to prevent a heart clot from forming. We will continue to watch her. We want to make sure her heart will continue to improve. And if there's any problems, we will have to develop a plan to take care of her in the future.
She is rambunctious and fun and energetic. It's funny, a lot of the doctors that we see and sonographers now say you look at her and she looks like a typical toddler, like that there's nothing wrong. And then you look at the ultrasound images and you're like, how? Every appointment I ask them, like, can I get her in gymnastics? Can I get her in dance now? And every time they're like, she seems to be doing good, let's do it. So
we think she has more energy than we thought she ever would have.
Yes.
So.
It's a privilege for us to take care of her, her family, and other children of their families in our community. And she's performing beautifully, thriving, very smart, very active. She does anything she wanted to do. Our family is very happy with her progress, and I'm very happy with her progress.
Any sort of physical activity, she is all about.
You'll see us go down the slide about 100 times. So.
Yeah. She is in dance right now, and she asks every single morning she wakes up, dance, dance. She wants to go to dance every single day.